we've been looking at what our community needs are at a broad level, and we think that that our seniors are a population that would be ripe for mobile integrated healthcare. We think that injury prevention is something that would be ripe for mobile integrated healthcare, and we think that our high system utilizers are something that would be very ripe for mobile integrated healthcare in our region. Certain areas of the city have sort of unique needs within those broad categories. We haven't yet taken a deep dive to look closer at what that would mean, but I think that we all think those are three things that we'd like to really work on as we move towards the future.
I think as we've looked at this, and we have been thinking about this for a while, it really started to get feed is when Mayor Rahm Emanuel, he went to another city and saw this. And he liked the idea of a mobile integrated program and approached our fire commissioner. And the fire commissioner was very, because it at least started talk, let's see if it's a feasibility. And then we started looking at our numbers, and we have a fair amount of number of falls, a fair number of, going in there and seeing, just need like a well-being check, they're okay. And so when we started looking at that, we thought, this is something maybe we should approach our systems with, our doctors. And we do have a history of working on these types of programs, which first step you could talk about.
Well, years ago we had a program in conjunction that would not have worked and off the ground at the University of Chicago. And it was based in the public housing development known as Robert Taylor Homes, which is the largest one in the country at that time. The issue was how to get pre-hospital care to the scene as soon as possible in the high volume area, high call area, and the concept of training residents to become emergency medical technicians and empowering them to respond to calls within the development, provide pre-hospital care while waiting the fire department ambulance to arrive on the scene was vital and was very successful for us. But also, at the encouragement of the UFC, we expanded the scope of their services, not just EMS, but blood pressure screenings, healthcare screenings. We were in a couple of health fairs in conjunction with the Department of Health within the developments, and they were an integral part of that. It was overall successful. The program disappeared when the public housing development disappeared. but it had a positive spillover effect because it also provided us with an opportunity to provide training to residents, many of whom went on for further training, who are now, 20-year members of the Chicago Fire Department.
Really?
So it's been very positive in that regard.